Hi guys, it is October the 6th. It's the day of my surgery, which seems weird because how can I be having surgery if I'm in front of you? Well, it's because I pre-recorded. I am going to be in surgery today, but that doesn't mean that you can't talk to anybody or you can't get any help. Miss Holly is here at school and she can answer questions for you. But I am actually going to take a moment before we get into our lecture to just talk to you about what my expectations are for today and tomorrow. I'll get out of the hospital tomorrow, which will be Wednesday, and on Wednesday afternoon, I'm hoping I'll feel better when I get home and all of that, but I'm sure I'll be reaching out to you guys on Wednesday. So today, you're going to do your lecture video, okay? Going to listen to your lecture video. Then you're going to be reading chapter 13. This is a very small chapter. Shouldn't be hard for you to get through the reading. I'm going to be putting it on Edmodo, but I'm just talking to you about it now. So you're going to submit Quick Check 13.1 as part of your assignment for your lesson. Your lab today is going to be your exercises 13.1 through 13.3. And your review. 2019, that whole review. 2020, you're going to be doing learning objectives. Page 370, number 1 through 7. And your glossary review on page 371, 1 through 5. So that is your lab. I need you to shoot pictures of that and send it to me. Then for homework, you're going to be reading the integumentary system in your little, oops, sorry guys, I just wiped myself with it. Let me put that over there. In your little workbook that you have, you're going to do the integumentary system, page 17 through 22. Okay, so what are my expectations for tomorrow? Tomorrow you'll do chapter 13 workbook. Then you're going to have a lab and a homework that's just going to be integumentary system. So you guys are going to notice that we're going to do a lecture. We're going to read our chapter. We're going to do our exercises. We're going to do our review. We're going to do our workbook. And then we could possibly do a coding packet if there's time. That is the pattern that we pretty much stay in. I throw in some anatomy, I throw in some projects, but pretty much the structure and the basic parts of the work are lecture, read your chapter, do your exercises, do your review, do your workbook. So anyway, all right, so I hope that that was all clear for today and tomorrow. It's going to be very laid out, very easy for you to do. So I'm going to share my screen, and then what we're going to do is we're going to actually do our lecture. There we go. Chapter 13, Surgery Guidelines in General Surgery. Fun, fun, fun. So the surgery section is the largest CPT section. It starts with 10004 through 69990. Now, I do want to amend that. The actual very first code in the surgery section in 2020 is 10021, which is fine needle aspiration. And then the excuse me, the surgery section ends with 69990, which is the operating microscope. It's divided by subspecialty, which would be like the integumentary system and the cardiovascular system. So how many subsections are included in the surgery section of the CPT manual? 19. So next we're going to be talking about notes and guidelines. Notes and guidelines are found throughout the sections. Information can be varied and is very extensive and is must reading, which means you need to read these notes and guidelines. You need to highlight, make notes of your own. Can subsections have their own notes with special instructions? So, can subsections have their own notes? Well, sure they can. You need to be aware of all the guidelines you're going to have in your green section at the beginning, or in the green part where your guidelines are. There's lots of information, but it's also going to be found throughout your chapters in your CPT. So let's talk about CPT manual text changes. You guys see these little triangles facing each other? When you have a new text change, it's going to be prefaced by this little triangle, and it's going to end with a little triangle, letting you know it's new or revised text. Okay, the next part that we're going to go into, I want you guys just to bear with me, okay? Bear with me because there's lots of subsections and categories and subcategories and subheadings. I'm going to show you a way that you can do this that will help you understand what you're looking at. It's going to kind of trick your eye. So I want you to bear with me. Let's get through the information, and then I'm going to back it up and show you what I do, okay? So subsection notes. Subsection notes apply to the entire subsection. So for example, on figure 13.2, the musculoskeletal system, and you're going to see that there are notes below that. Sometimes there are definitions. Sometimes there are just great amounts of information that's going to help you code accurately. Subheading notes. So for example, spine, vertebral column, it gives you great notes. Subheading notes apply to the entire subheading. So it would apply to everything in the spine and vertebral column subheading. Category notes. So your category here are grafts or implants. And category notes apply to the entire category. Subcategory notes. And again, that's the same thing. Subcategory notes apply to the entire subcategory. Okay, this is the slide that I want to stop on, because we were talking about section, subsection, subheading, category, subcategory notes, and you're thinking, oh my gosh, what in the world are all these things? Well, if you open up your CPT at the beginning of, let's see, where are we going to go? The beginning of your surgery section. What I have simply done is I used actually pink and yellow, and all that I did was I highlighted my surgery here, pink, and that is my section. Then I highlighted my digestive system, yellow, which is my subsection. Then I know that anything that's written here, and it's written in red, I highlighted a different color. Then my repair, I highlighted green because that's my category. And then my subcategory, I highlighted a different color. So that way you're going to know what you're looking at. until you learn what is section, what is subsection, what is subheading, what's the category, what's the subcategory. I'm going to tell you guys, this throws me for a loop every time. I have to draw myself a diagram because I get lost in what I'm looking at. Even though I've taught it several times and I always, you know, make notes, it just jumbles in my head. This is one of those things that just jumbles in my head. So take time to color code, or take time to draw a diagram in a notes part where you know what is what. Additional helpful notes. Parenthetical information. Parenthetical notes provide additional information that will aid the coder in making correct coding decisions. So what is parenthetical information? It's information in parentheses. So let's talk about unlisted procedure codes. So we're only going to use unlisted procedure codes when more specific category 1 or category 3 codes are not found. Okay, now I want to stop here and tell you, category 3 codes are found in the back of your CPT manual. Find your category 3 codes, make sure you have the category 3 tab on it. Just look and see what's there. You must attach a written report to accompany the submission of an unlisted procedure. Each unlisted code service paid on a case-by-case basis. Okay, so this is another thing. This is a slide that I don't like. So this is what I want you to do. I want you to pull out your step-by-step step book. And 2019 edition, I want y'all to turn to 347. And 2020 edition, I want you to turn to 363. And so we're actually going to read this together in our book, because I think it explains it better in the book than it actually does in the slides. So, separate procedure. Some procedure codes will have the words separate procedure after the descriptor. The term separate procedure does not mean that the procedure was the only procedure that was performed. Rather, it is an addition of how the code can be assigned. Let's locate CPT code 19100. So let's turn to CPT code 19100. All right, so 19100, and again, I know there's a slide up here, but you should be listening to my voice. 19100 says biopsy of breast percutaneous needle core, not using imaging guidance, separate procedure. So that's in parentheses, separate procedure. So we're going to turn the page over to 364. Procedures followed by the words separate procedure in parentheses are considered minor procedures that are reported only when they are the only services performed or when they are performed with another major procedure but a different site or unrelated to the major procedure. When the minor procedure is performed in conjunction with a related major procedure, the minor procedure is considered incidental and is bundled into the code for the major procedure. Okay, a lot of words, right? Well, if you look on page 364 for 2020 and 348, excuse me, for 2019, you have examples. There's 1, 2, 3, 4 examples of separate procedures and when they're bundled and when they're not. I would like for you to get in those examples and read and discover for yourselves. I'm hoping that you're going to understand that a lot better than me trying to do these slides where that to me it doesn't make a lot of sense. So we're going to get through this one. Separate procedures reported when only procedure performed with another procedure on a different site or unrelated to the major procedure. So now we're going to talk about minor procedures. Minor procedures are often provided on a service-by-service basis because they lack significant elements of preoperative and postoperative follow-up and tend to be straightforward and limited in scope. Major surgical procedures, on the other hand, are often coded as a bundle of services that reflects the standard care the surgical patient can be expected to receive in connection with the procedure. Okay, so let's look at it again. Minor procedures, often on a service-by-service basis, often do not have bundle of services. Third-party payer decides what is in the surgical bundle, and minor procedures for Medicare has a 0 or a 10-day global period. So next we're going to talk about those lovely third-party payers. Third-party payers vary in definitions of what is included in a surgical package. This will vary what you can and cannot submit separately for reimbursement. So let's talk about major guideline of surgical package. First of all, I want you to know that the green part in your surgery guidelines, before you ever get into the CPT codes, you're going to find CPT surgical package definition. You need to read that and highlight what the important information that you find in your surgery guidelines. I want you to read it. I want you to highlight what's important, and I want you to send me a picture of it as your assignment. Okay, so major guidelines of the surgical package. Okay, the surgical package includes a global package that consists of preoperative examination, the surgical procedure, and the postoperative period. When a patient is hospitalized and it is determined that he or she needs surgery, he or she would have a preoperative exam, and no E&M charges after this day can be billed if they are due to the reason the patient is having a surgery. The insurance company set the postoperative global periods, and it's typically 10 or 90 days. So let's recap. Major surgical procedures usually include preoperative before, intraoperative during, and postoperative after, also known as global period, and minor complications. Okay, so I want to talk to you about a global period real quick. So say that, let's use Alexis, because everybody knows Alexis, and they know she just had Phelan a few months ago. So Alexis goes to the OBGYN. She sees her OBGYN all the way through her pregnancy. She goes into labor. She has the baby. So she has the baby. And then after 6 weeks, she has to go to her post-operative checkup. Well, I don't know if you guys have ever noticed, but when you go after having a baby, after the 6-week period, you don't pay anything because that's part of your global period. Anything that would happen within that, the 90 days or the 6 weeks, 6 weeks and 90 days don't equal, but usually for OBGYN and having a baby, it's 6 weeks. So anything that happens that was related to that birth or pregnancy within the next 6 weeks, the insurance will pay 100% because they include that into the price of the delivery. So I hope that that makes sense. So we're going to talk a little bit more about major guidelines of the surgical package. Oops, sorry, let me go back. One bundle, one price. So we were just talking about that delivery, everything that she paid for that delivery is bundled into what she would have post-op to do with giving birth in that 6-week period. So it was one price for whatever leads up behind that has to do with that birth. One bundle, one price. Minor procedure may have no bundle, and it varies by the payer. So we're going to talk about an example. Okay, let's ask a question. What procedures or services that are related to surgery are billed separately from the surgical package? When bundled services are delivered, all services provided during the standard postoperative period are included in the surgical package price. For major surgery, this period typically covers the 90 days following surgery. When minor surgical procedures are delivered, preoperative and postoperative care are not typically bundled into a surgical package. Instead, all services are reported separately. Remember, that's minor. It's reported separately. The global period for minor procedures is 10 days following the surgery. General anesthesia is typically not bundled, but rather is billed separately by the anesthesiologist. So most payers specify 90 days after a major surgery and 10 days after a minor. All services related to surgery are part of this package, which is that 90-day global, which includes pre-op, intra-op, and post-op. So let's talk about what's never in the surgery bundle. General anesthesia is a separate specialty and performed by an anesthesiologist. This is always separately reportable. So more on our surgical package. Okay, many minor procedures have 0 global days assigned to them. This allows for separate charges to be billed for preoperative and postoperative service. This varies by payers. So let's talk about some minor surgery examples. Needle biopsies in the office. What would you report? Procedure and the supplies. Your procedure is the biopsy and your supplies are the surgical tray. If there are no global days assigned to a minor procedure, could you bill for the postoperative visit 3 days following the minor procedure? Well, yes, you can, because there's no global. You can bill that postoperative visit. So next we're going to talk about our surgical trays. So what's included in a surgical tray? Needles, suture materials, wipes, drugs. You can report a surgical tray with the CPT code 99070 and with HCPCS code A4550. And what you can see on both of these examples is that Medicare bundles this into the procedure code. Yes, into the procedure. So you cannot bill either one of those things, a surgical tray, either one of those CPT codes to Medicare. So this is another thing that, oops, sorry guys, skipped it again. The way that this slide is laid out is a little confusing. So I'm going to start out by saying outpatient coders address physicians, inpatient coders address hospital or facility payments. Okay, when you're whenever you're addressing a physician payment, you're using CPT codes. Hospital our facility payments goes by ICD-10 because a physician, it's what he does is how he gets paid. Hospitals, it's how sick are you? What is the worst diagnosis you've got all the way down to the least? The sicker you are, the more the reimbursement for the hospital. So you guys remember that CPT is physician patient, ICD-10 is hospital. Now, does the hospital use CPT codes? Of course they do, but that's not where they get their money. They get their money in how sick you are. Does a physician use ICD-10 codes? Yes, he uses diagnosis codes, but it's all about what he does to make you better. Physicians get paid on what he does. Hospitals get paid on how sick you are. I hope that makes sense. So general subsection 1004 through 10021. Fine needle aspiration biopsies with or without imaging. So what is a fine needle biopsy? A fine needle biopsy is used to withdraw fluid and contains individual cells. The needle is inserted into the area and moved several times to take multiple samples without withdrawing the needle. That's what I had done on my little thyroid knot here. Let me make a note. The fine needle aspiration biopsy is different from needle core biopsy. In the latter case, the biopsy site is exposed to the physician, who then removes a portion of the lesion for examination. So the fine needle biopsy, and you can see it's in her throat. She's probably having the very same procedure that I had without anesthesia. I'm a tough girl, yeah. So anyway, so that is the end of this lecture. I hope that you guys learned a lot. I know that some of these things are a bit confusing because there's lots of words, but that's why you need to make sure that you're reading your chapter. Have a wonderful day. If you need to call on each other for support or help, please do so. You can text me. I'm just not sure if I'm going to be able to answer after surgery. But anyway, I love you guys. I hope you have a wonderful day. I'll be talking to you tomorrow. Do your work. Submit on Edmodo. Don't make me call you guys after surgery. Bye, guys. Have a good one.